Hi, this is NUR404, caring for clients with a chronic disease. Lisa Carney, RN, the University of Arizona Global Campus, Dr. Latanya Santo, April 22nd, 2024. The objective of this PowerPoint is healthcare providers must provide clear, accurate, and accessible information to clients and their families to ensure optimal outcomes. Educating patients on self-management skills to better manage their illness, monitoring and managing symptoms to prevent complications and improve quality of life, collaborating with other healthcare providers to coordinate care, ensuring all patient needs are addressed, supporting emotional and well-being of patients and their families as they navigate the challenges of living with a chronic disease. My name is Lisa Carney. I am currently the RN Breast Imaging Navigator for a comprehensive breast imaging center. I've been a registered nurse for 35 years. My background includes medical surgical, cardiovascular ICU, heart-lung transplant, surgical ICU, primary RN for Indian Health Services, a home infusion nurse, and then a chemo-certified infusion nurse, and my current role, which is that of an RN navigator. The effects on the patient with a chronic illness travels a continuum of stress, coping, resiliency, and understanding the mechanisms of self-management. The experience of living with a chronic illness is a dynamic process that reflects both wellness and illness. It is important for nurses to recognize and support individuals with all types of chronic conditions, as they can have a significant impact on their overall well-being. In illness experience, we talk about the lived experience of the individual and the family diagnosed with a chronic disease. The formation of the patient's perception of a chronic illness is a complex, multidimensional process involving much more than physical symptoms. The illness experience is unique for each patient and their family. Illness perception and beliefs are related to behaviors and coping. This is a sociological view of the disease as experienced by the patient and family rather than a medical view. The individual's and family's values impact their perceptions and beliefs of the condition and thus their illness and wellness behaviors. Structures of everyday life and the forms of knowledge are disrupted. Realization of the worlds of chronic pain, suffering, and distant possibility of death exist. The need for targeted interventions is needed, such as information giving, support groups, group therapy, including techniques to support one's self-regard. Chronic illness can be described as a complex relationship between the individual and their world. Chronic conditions are long-term issues and can affect the body, such as arthritis, diabetes, and fibromyalgia. Chronic conditions can also include mental health disorders such as depression, anxiety, and bipolar disorder. It's also important to recognize the chronic conditions that may not have a physical outward appearance but still impact a person's daily life, such as chronic fatigue syndrome or irritable bowel syndrome. It's important as nurses to recognize and support all chronic conditions to provide the greatest support and overall well-being. Social isolation. Humans are social beings. The idea and impact of social isolation on humans, their families, and communities is a relatively new scientific concept. Social health is critically important in managing chronic illness. The existence of social isolation increases need for humans to associate with each other. It is vital to understand the psychosocial construct of social isolation. It influences how patients respond to every aspect of care. According to Larson, social isolation is the distancing of an individual psychologically and/or physically from their network of desired or needed relationships with other persons. Defined specifically, social isolation is a state in which the individual lacks a sense of belonging socially, lacks engagement with others, has a minimal number of social contacts, and they are deficient in fulfilling those quality relationships. One intervention the nurse could implement for a 7-year-old boy with hemophilia would be to organize a play date with other children to prevent social isolation. Educational talking points for the family would include educating on what hemophilia is and how it affects the body, the importance of being careful to avoid injuries that could lead to bleeding, and teach them how to advocate for himself and communicate his needs to others. Health-related quality of life, physical health and the managing of symptoms, psychological health by providing support for mental wellness. Level of independence also includes promoting healthy lifestyle choices. In social relationships, it remains important to facilitate social connections. Health-related quality of life refers to how an individual's overall well-being and satisfaction with their health and daily activities is affected by their health condition. It includes physical, mental, emotional, and social aspects of life. It is important for healthcare providers to assess and address these aspects and to improve the overall quality of life for their patients. A best practice intervention for a 6-year-old male 3 days post cerebral vascular accident could be recommending a comprehensive rehabilitation program that includes physical therapy, speech therapy, and occupational therapy. It would also be important to provide education and support for post-stroke symptoms such as weakness or speech difficulty. The nurse could provide the following educational talking points: the importance of following prescribed treatment plan, including medication and treatment plans. Provide information on warning signs of complications and when to seek medical attention. It is important to offer resources for support groups or community services assisting with adjusting to life after stroke. Powerlessness. Powerlessness is a profound feeling that at its core can result in anxiety, fear, and uncertainty to hopelessness. Powerlessness is a feeling of lack of control or agency over one's life circumstances, leading to a sense of helplessness and inability, perceived or actual, and the lack of strength to change. Powerlessness is an experience that many individuals undergo at some point in their lifetime, and patients with chronic disease are especially at an increased risk. Empowerment and knowledge are two main interventions to address powerlessness. Chronic illness patients may have debilitating symptoms that interfere with day-to-day functioning, causing feelings of powerlessness. Chronic illness patients move through a continuum of wellness and illness, power and powerlessness, hope and despair. Powerlessness encompasses loss, uncertainty, chronic illness management, dignity, and vulnerability. Empowerment through education, information, can teach skill building, providing a person with information about their condition, treatment options, and coping strategies can help them feel more in control of their situation. Teaching practical skills such as problem solving, communication, and stress management can empower them to take charge of their own well-being. An intervention for a 20-year-old with schizophrenia could be to empower them with the knowledge of their treatment plan and decision-making process. This could include discussing medication options, therapy goals, and lifestyle changes, allowing them to participate in their own care. Intimacy. Maintaining closeness, understanding, and support during chronic illness. Intimacy in the chronic illness setting refers to the emotional and physical connection between partners affected by a long-term health condition. Definitions of intimacy tend to evolve over the course of the illness. Adapting to changes in physical abilities, it often shifts within the roles of the relationship. Definitions of intimacy tend to evolve over the course of the illness. It is important for couples to openly communicate their needs, their fears, their concerns to maintain a healthy and fulfilling intimate relationship. It is difficult for the healthcare professional to predict the specific impact sexuality and intimacy will have on a person or couple dealing with the new onset of lower extremity paralysis. The nurse should plan on exploring alternative forms of physical intimacy, such as using assistive devices such as vibrators or adapting positions such as oral sex. It will be important to keep the communication open and discuss renegotiating what intimacy looks like for this couple. Gender differences in intimacy need or warrant definition. Influences on intimacy may also include religious beliefs, age, education, level of comfort with one's own body, and the health of each partner. Resources and support groups for patients with similar challenges, as well as offering guidance on maintaining emotional connection and intimacy through verbal communication, emotional support, and shared activities. It is important the nurse remember to discuss this topic with the utmost sensitivity and empathy while encouraging the patient to explore new ways of connecting with their partner. According to Friedman, despite the difficulties people with disabilities may have in developing an intimate relationships may be especially beneficial for people with disabilities as they foster greater self-acceptance, less internalized stigma, and more fellowship. Coping. Factors affecting coping: presence of therapeutic intervention, habit and behavioral factors, relational social factors, individual differences, values and beliefs, emotional factors, and healthcare systems play a role in helping or hindering one's ability to cope with chronic disease. Coping is defined as thoughts and behaviors that people use to manage the internal and external demands of situations that are appraised as stressful. Coping strategies are identified as either emotion-focused strategies or problem-focused. These two strategies are not to be treated independently as they frequently complement each other. Emotion-focused coping is regulating those emotions brought on by the stressful event, typically experienced as a way of escaping the situation, while problem-focused coping is a strategy used when a patient wants to solve or alter the situation. This typically occurs because the patient believes they can alter the situation. A coping intervention for a patient with bipolar disorder includes establishing a routine, practice relaxation techniques, work with a trauma-informed therapist, and seek support from those who are supportive and not judgmental. Nursing educational talking points for the patient and family to include understanding the symptoms and triggers, trauma-informed therapy support groups, and healthy coping strategies. It is also so important to provide education in a clear, concise manner while also encouraging open collaboration in the treatment process. Self-management. Self-management is an individual's ability to manage their own health and make informed decisions about their care. Self-management can be monitoring symptoms, adhering to treatment plans, making lifestyle changes, and seeking support when needed. Self-management is achieved through self-monitoring and organization of medication and treatments, awareness of symptoms, and strategies to promote health. Self-management requires both critical thinking and reflection. Self-management empowers individuals to take control. Self-management implies that the individual with chronic illness is self-motivated, empowered, and engaged in daily management by making informed decisions regarding health, life choices, and symptom management. Self-management is intentional as it uses a specific process, can be affected by specific programs and intervention and results in specific types of outcomes. Interventions applicable to a 12-year-old with type 1 diabetes would be to teach or coach, regular blood sugar monitoring, healthy meal planning, regular physical activity, and medication management. Creating a personalized diabetes management plan for the child and her parents, which includes setting goals, will help her develop a sense of responsibility and ownership over her health. Spirituality provides comfort, hope, and sense of purpose during difficult times. Spiritual practices can help individuals find purpose and meaning, as well as connect with others and the otherworldly within their illness experience. Spirituality and religion can overlap for some individuals. Believing in something beyond the physical world can provide a sense of meaning for some. Spirituality is fluid and open to interpretation, while religion may have strict guidelines and structures. Spirituality is part of compassionate, patient-centered, and holistic care. Spirituality is often seen as having more than one definition, as it involves multiple ways of knowing, including cognitive, experiential, intuitive, aesthetic, and an inner sense of knowing. Spirituality can play a significant role in coping with chronic illness. Integrating spirituality into the care plan can lead to a better well-being. It can provide comfort, hope, and a sense of purpose during difficult times. Spirituality is often seen as a more personal and individual connection to a higher power or greater sense of purpose, while religion is typically associated with organized belief systems, rituals, and practices shared by a group of people. It is important the nurse obtain the cue from the patient with arthritis. If spirituality is engaged, the nurse could promote self-reflection, promoting connections with loved ones, prayer, meditation, and mindfulness. The nurse could reinforce with the family these above interventions while also seeking support from a spiritual community. It is important to remember these interventions can help provide comfort, perspective, and connection for the patient with arthritis. Client and family education. Client and family education is crucial in managing chronic diseases and illnesses. Client and family education can improve outcomes and enhance communication between the client, their family, and their medical team. Adhering to educational plans empowers clients and their families. Healthcare providers must provide clear, accurate, and accessible information to clients and their families to ensure optimal outcomes. Evaluation of educational outcomes is a critical step in the teaching and learning process. Client and family education is crucial to so many aspects of an individual's disease process. When the healthcare professional performs the initial learning assessment, this must be given the proper assessment and remain free of judgment. An educational assessment must assess the learner's needs, readiness to learn, and learning style. The healthcare provider must be an astute listener and capable of developing an individualized client-family goal. It remains very important for a healthcare provider to provide a supportive environment for managing chronic diseases. Teaching an 8-year-old with asthma may include teaching their family about asthma triggers, symptoms, and how to properly use medications such as inhalers. Educating the family and client on recognizing the early warning signs of an asthma attack and what to do in case of emergency. Lifestyle modifications such as avoiding exposure to irritants, maintaining a healthy diet, and staying physically active can also be part of the educational plan. Social support. A strong social support system helps patients cope with the challenges of living with a chronic condition, both mentally and physically. Social support can come from family, friends, healthcare providers, support groups, or online communities. Social support can provide a sense of belonging, reduce feelings of isolation, and offers encouragement and motivation. Key concepts of social support are structural support and functional support. According to Larson, Social support refers to social relationships with family, friends, community, and the healthcare system, which provide available or perceived assistance. Social support plays a crucial role in managing chronic illness, and it is important for individuals with chronic illnesses to cultivate and maintain social connections to help them navigate the ups and downs of their condition. Structural support refers to the extent to which individuals are integrated into social networks, while functional support refers to perceived and received social support. A social support intervention for a 14-year-old with depression could be group therapy because this allows individuals to connect with others who are going through similar experiences, providing a sense of understanding and community. Educational talking points could include explaining what group therapy is, discussing the importance of sharing and listening to others in the group, emphasizing they are not alone, and reaching out for help to share their struggles, fostering meaningful connections. Adherence. Treatment plans have become complicated, while patients have an increased responsibility in managing these regimens. Patients' active participation is ultimately their responsibility for their own health, allowing them empowerment in following health advice. Promoting adherence is one way to prevent worrisome consequences of chronic disease. Factors contributing to adherence may include psychological factors, social support, prior health behavior, somatic factors, regimen characteristics, economic and cultural factors. Adherence to treatment affects the management of chronic diseases, and a great number of patients do not follow prescribed treatment. Inadequate adherence to treatment may limit the efficacy of prescribed therapeutic regimens. Adherence is defined as the extent to which a person's behavior taking medication, following a diet, and/or executing lifestyle changes corresponds with agreed recommendations from a healthcare provider. To enhance adherence to chronic illness, the nurse can implement three strategies: educational, behavioral, or organizational. Educational interventions can be based on the patient's level of knowledge, while behavioral strategies attempt to directly influence adherence to specific plans and organization. Culture and health disparities. Social determinants of health, racism in healthcare, health disparities in healthcare by race and ethnicity, access to care, sexual and gender minorities. Culture can be defined as the learned, shared, and transmitted values, beliefs, norms, and life ways of a particular culture that guide thinking, decisions, and actions in patterned ways. Cultural and health disparities among patients with chronic conditions can have a significant impact on overall health. These disparities can arise from factors such as socioeconomic, access to healthcare, language barriers, and cultural beliefs and practices. The healthcare system needs to address these by providing culturally competent approach to care, providing language support, addressing social determinants such as housing instability, food insecurity, and transportation issues. Offering culturally appropriate care along with collaborating with community resources will set the provider up for delivering more effective care. The Purnell model for cultural competence, because of the unique cultural and hereditary significance of sickle cell and its medical effects on the body. It is important for the family to understand the basics of the disease and the symptoms and the management of a sickle cell crisis, such as severe pain and fatigue. Knowing when to seek medical attention, educating family members on the importance of staying hydrated, getting enough rest and avoidance triggers, the importance of genetic counseling, resources, and mental health support. Family caregiving. Caregiving for a person with chronic illness has grown, and the dynamic is complex. Caregivers in a family system may feel they have no choice. Cultural, generation, gender, socioeconomic status, geography, care recipient illness or impairment are reasons to one becomes a family caregiver. Caregivers can assume the role suddenly during an acute event or as a gradual chronic process. Motivating factors to be a caregiver can also include love, obligation, religious training, and spiritual experiences. Family caregivers play a crucial role in the healthcare system, often taking on significant responsibilities and making sacrifices to ensure their loved ones receive the care they need. Family caregiving refers to the unpaid care and support provided by family members to a loved one who is unable to care for themselves due to illness, disability, or aging. The demands of the mom who works part-time and cares for an autistic child increases the stress due to her other familiar circumstances, which can include the demands of her job and other children. It is important for this mom to prioritize self-care, implement low-demand parenting, seek support to prevent burnout. Building a strong support network is essential, as is accessing respite care services and staying informed about resources available. Models of care. Chronic care model, patient-centered medical home, comprehensive primary care, family-centered integrated care, collaborative care, transitional care models. In this paper, we're going to discuss the chronic care model and the family-centered integrated care model. The chronic care model is a framework developed to improve the management of chronic conditions by emphasizing the importance of self-management support, the delivery of system design, decision support, clinical information systems, community resources, and healthcare organization. The purpose is to enhance the quality of care for patients with a chronic illness through a collaborative and proactive approach with their healthcare team. The family-centered integrated care model takes the chronic care model and incorporates the family into treatment plans and decisions. These family members may assist with the simple activities of daily living to implementing complex chronic illness strategies. Although similar in name, the Medicare and Medicaid programs vary in the health services they provide and the populations to which they are provided. Medicare is federal health insurance for anyone age 65 and older, and some people under 65 with certain disabilities or conditions. Medicaid is a joint federal and state program that gives health coverage to some people with limited income and resources. The Social Security Administration considers COPD a disability. He'll be required to test his respiratory function and submit documentation from his healthcare team. This patient could benefit from pulmonary rehab, which provides non-invasive approaches intended to improve the quality of his life. Primary care. Primary care is team-based care and practice organization. It's knowing and managing your patients. It's patient-centered access and continuity, care management and support, care coordination and care transitions, performance measurement and quality improvement. Primary care is comprehensive, first contact, acute, chronic, and preventive care across the lifespan, delivered by a team led by the patient's primary care provider. It also includes care coordination across the continuum of care. Although the patient-centered medical home initially focused on the patient-physician relationship, the concept has evolved to emphasize a team-based approach to care that is patient-centered with a focus on care coordination, communication, and improved patient outcomes. The best practice for a 45-year-old with cancer would be the patient-centered medical home. This approach is patient-centered, comprehensive, team-based, coordinated, accessible, and focused on quality and safety. This approach would optimize care for those with a chronic illness such as cancer. The team could include oncologists, social workers, and dietitians. Community care. Community health nursing and public health nursing are often used interchangeably. They're both promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. Public health focuses on preventative care and health promotion while also focusing on chronic illness, non-communicable disease, and local community-based approaches to care in general. Community health nurses work in a variety of settings: community health clinics, home care, school-based clinics, governmental agencies, institutions, and public health. According to Larson, the social ecological model is a theory-based framework providing a framework to better understand how individuals' health is influenced by larger structures and relationships. The levels in this model are individual, interpersonal, community, institutional, and policy environments. Nursing-led interventions include health education, case management, collaboration, and the use of digital health. Each of these is essential in supporting persons and families with chronic illness in the community. Post-acute care. The benefits of post-acute care: they maximize patient health, the prevention of subsequent medical complications, lower rates of readmission to the hospital, more time with doctors and personal attention, improvement of functional skills, earlier return home for patients, restoration of independence of patients, and they promote a participation in society. Post-acute care is an umbrella term that encompasses those health services provided after the acute care hospital stay, which can be provided on an inpatient or an outpatient basis. Following an acute care stay and/or procedure, if the patient requires post-acute care, it is typically in a long-term hospital, inpatient rehabilitation facility, skilled nursing facility, and/or home health service. Along the continuum of long-term care, problems in the delivery care could entail overall system breakdown, gaps in care and funding, staffing, and standards of care. A care option for a 16-year-old with cystic fibrosis would entail a multidisciplinary team of healthcare professionals, including pulmonologists, respiratory therapists, social workers, and dietitians. An inpatient rehabilitation center would offer the best post-acute care for this type of patient. Palliative care. Palliative care provides relief from pain and other distressing symptoms, affirms life and regards dying as a normal process, uses an interdisciplinary team approach to address the needs of patients and their families, including bereavement counseling, if indicated. It also enhances the quality of life and may also positively influence the course of illness. It offers a support system to help patients live as actively as possible near death. It also integrates the psychological and spiritual aspects of patient care. It intends neither to hasten nor to postpone death. Palliative care focuses on expert assessment and management of pain and other symptoms, assessment and support of caregiver needs, and coordination of care. Palliative care attends to the physical, functional, psychological, practical, spiritual consequences of a serious illness. It is a person and family-centered approach to care. It is a type of care that focuses on providing relief from the symptoms and stress of a chronic illness. It can be provided alongside curative treatments and is not just limited to end-of-life care. Hospice care is specifically for individuals who are nearing the end of life, and the focus is on providing comfort and support to both the individual and their loved ones. Hospice care is typically provided when curative treatment options are no longer effective or desired, while palliative care is focused on providing relief from the symptoms regardless of the stage of the disease. All hospice care is palliative. However, not all palliative care is end-of-life care. Palliative care for a 90-year-old man with more than 6 months to live would be symptom management, enhancing the quality of his life while focusing more on comfort care versus curable care. Complementary and integrative health. Complementary and integrative health includes treatments that utilize integrative therapies in Western medicine, which are intended to complement the patient's care. Complementary and integrative medicine tends to look at the whole person, mind, body, and spirit, rather than focusing on the symptoms. There are commonly two categories of complementary health therapies: natural products and mind-body practices. Some examples of those are deep breathing, acupuncture, meditation, massage, special diets, homeopathy, fish oil supplements, glucosamine, and chondroitin. The terms complementary, alternative, and integrative medicine are defined by the NCCIH. Alternative refers to using a non-mainstream approach in place of conventional medicine. Complementary refers to using a non-mainstream approach together with conventional medicine. And integrative medicine refers to bringing conventional and complementary approaches together in a coordinated manner. Over time, some alternative practices may evolve to be complementary with conventional medicine, for example, guided imagery and massage. Self-reflection should be the primary intervention on behalf of the nurse with an ALS patient wanting to implement herbal therapy to their regimen. And talking points for patients and their families would be to assume that the natural therapies will probably not be covered by insurance, to find out as much as you can about the alternative practitioner and confirm they will collaborate with your Western medicine provider. The experience should be empowering, safe, and a feeling of self-healing. Understand integrative therapies tend to not be researched in a scientific manner. Health policy. Health policy is individuals with a chronic illness deserve access to high-quality healthcare services that are safe, effective, patient-centered, timely, affordable, and equitable. Health policy there should not be a disparity in high-quality healthcare delivery, which does exist amongst the population. Understanding health policy is fundamental for nurses who want to improve population health in the healthcare delivery system by influencing policymaking. Nurses should be able to assess and understand current health policies that are relevant to their practice, identify the strengths and limitations of these healthcare policies, and then act to influence changes in health policy to improve care for patients with chronic illness and their caregivers. Health policy can be defined as the official or authoritative decisions made to guide actions, decisions, and behaviors of others. Health policy refers to the decisions that pertain to health or the pursuit of health that are intended to direct or influence the actions, decisions, and behaviors of others. To best support patients and their family, there needs to be a focus on education and awareness about chronic conditions which will empower patients to take an active role in their own health care. The stakeholders in our healthcare industry are large and diverse and include but are not limited to nurses, the elderly, hospitals, skilled nursing facilities, biotechnology firms, and etc. In conclusion, living with a chronic illness impacts one's functional status, quality of life, and identity in significant ways. In the light of loss, uncertainty, psychosocial adjustment, powerlessness, social isolation, and the constant demands of self-management and treatment adherence, the experience of living with a chronic illness often prompts questions of how to find meaning and the strength to cope. Nurses can contribute to those with chronic illnesses by developing a trustworthy relationship, open communication, educate patients about their disease, collaborate with other healthcare professionals, support well-being, and encourage self-care management.